Welcome to the Fund the People podcast. I'm your host, Rusty Stahl. I'm president and CEO of Fund the People, where our mission is to maximize investment in America's nonprofit workforce. We give funders and nonprofits cutting-edge ideas, research, and tools to help drive equity, effectiveness, and endurance in the social sector. So let's start the show. Welcome to the Fund the People podcast. I'm your host, Rusty Stahl. Thank you for being here. On this episode, you'll learn how one major national foundation is supporting policy advocacy groups that oppose attacks on critical social justice issues by the Trump administration. They are one of the first foundations that spoke out publicly against some of these policies when the administration got going. And so you'll get inspiration and tips for how your institution can effectively stand up and speak out for its values and support nonprofits doing that all-important policy work in this environment. So my guest today is Giridhar Mallya. Dr. Mallya is an MD and Master's of Science in Health Policy. He's a public health physician whose career spans government, philanthropy, and academia. His work leverages the power of public policy and community health interventions to shape the political, social, and economic determinants of health. He currently serves as a senior policy officer for the Robert Wood Johnson Foundation, where he leads a national initiative to defend racial equity, diversity, and inclusion in health and other sectors. Dr. Mallya was previously Director of Policy and Planning for the Philadelphia Department of Public Health, and he's a board-certified family physician and adjunct professor at the University of Pennsylvania. So, Dr. Mallya, welcome to the Fund the People podcast.
Thank you so much, Rusty. I'm so glad to be here.
Glad to have you here. Tell us about your work at Robert Wood Johnson. How have you taken your public health experience and concerns around injustice and these systemic issues of racism and other systemic barriers to our democracy and people's lives and translated that into philanthropic practice?
Yeah. So one of the big initiatives that I've been leading over the past 3 years now is a national effort to defend racial equity, diversity, and inclusion. So we started this work in 2023 in the lead up to the Students for Fair Admission case, which was about race-based affirmative action. Based on talking with racial equity leaders, civil rights leaders, we knew that was likely going to be a bad decision, that race-based affirmative action was going to be eliminated, but that opponents of equity efforts were going to latch onto that decision and weaponize it to try to discredit and eliminate equity programs in all sorts of sectors well beyond higher education, including health. So that was the impetus. And this work to defend racial equity has only become more necessary over the past year of the Trump administration. And I think our basic premise is that efforts to reduce racial inequality do a couple things. One, they help repair the harms of racial discrimination, both from the past and the present. They help to create truly equal opportunity in a society where that is so hard to access. And then finally, and this is a really important point that we believe deeply in, that when racial equity work is done well, it leads to changes in systems and services that benefit everybody. One of the things we're hearing a lot right now from opponents of equity is that it's zero sum. If equity efforts benefit people of color like me, then you as a white person are going to lose out somehow. Mm-hmm. That is a very prevalent notion, but we believe it is an inaccurate and untrue one. And healthcare is such a great place to point to actual experiences that show that's not the case.
Yeah, you're making me think about Jesse Jackson, who I've seen speak multiple times, and I think he always says white women were the biggest beneficiary of affirmative action. You know, that everyone kind of benefits from these efforts to create more access and opportunity and break down barriers to entry, whether it's for jobs or healthcare or education.
Can I give you a quick example, actually, from the health space?
Yeah, please.
We actually put together this 2-page brief that goes through 7 or 8 examples of how equity interventions in healthcare benefit everybody. So one that I talk a lot about is around cancer care. So cancer care is notoriously complex. People are sick, and then they're being asked to navigate this really complex maze of care with their primary care doctor, a cancer specialist, maybe other people who are helping them with their functional needs. This affects everybody who has cancer, but we see that people of color have worse cancer outcomes. So there was a health system in the South that said, we want to do two things at once. We want to reduce disparities in cancer outcomes and create cancer care systems that are better for everybody. So they did a couple things. They trained their cancer care providers on racial equity concepts. They analyzed their outcome data based on race and other factors. And then they brought in care navigators that were culturally competent and reflected the populations that were served in that community, including having care navigators from the same communities and from the same racial and ethnic backgrounds as patients in their system. They put this intervention in place, and they found that timely completion of lung and breast cancer treatment increased for everybody, Black patients, white patients, and that the gaps between Black and white patients, which were pretty big at the start, closed to almost zero. So that, to me, is a great example of how an equity strategy in healthcare does those two things at once. It closes gaps, it repairs harm, but then it makes the system better for everybody.
Wow. Can you just dive into that a little bit deeper? So it closed the gap between white people's results in terms of the cancer and people of color, and then basically all the patients got better service, got better care, or better outcomes in terms of resolving their cancer. What do you think drove that, just making the service better for everyone?
It's a good question. And I think why it happened is because first they addressed a common issue, an issue that was common across people of all racial and ethnic groups. And that was that people needed somebody to help them work their way through the system. Like, do this next, make sure to prioritize this at your visit, remember to advocate for your access to this service. So that was a common problem, and they addressed that through a common intervention. But then, importantly, it wasn't ignorant of race and racism. It recognized that people of color, and there's unfortunately a ton of research on this, not only get lower quality care in the same systems, but they're often dismissed, ignored, and disrespected in healthcare settings. So they trained providers on racially equitable, culturally competent care. They didn't leave that part out. They had care navigators that weren't just the next person who walked in to their office. They chose those people to reflect the underlying diversity in their community. So that part of it that was race conscious, that's how I would describe it, helped close the gaps. So I think it's that combination of addressing a common issue, but then bringing a very strong racially conscious lens to the intervention is what allowed everybody to benefit and the gaps to close. What we see in a scenario when you're not race conscious, when you just ignore race and you say, well, a rising tide will lift all boats. That's true, but any pre-existing differences just get perpetuated.
Yeah. So everybody could get one of these navigators. So everybody got the help they needed to navigate this complex system. And they recognized these are the people we're serving. Let's get health navigators from those communities so we can serve them not generically, but as well as we can. Because the healthcare system it's intimidating. And if you already feel unseen, invisible, marginalized by big systems that you don't, have a special inside view of, it's hard to navigate those. If you don't have a lot of money to get lawyers or coaching or people to advocate for you, if you don't have all of these resources that some people take for granted and other people don't even know exist, then you need some support to navigate these systems. It makes sense. I think the same thing happens in philanthropy. I remember a colleague of mine was trying to kind of break into conversations with some foundation presidents, and I had some of those relationships already. And he said, well, how do you do it? How do you get these meetings? And I said, you just have to act like a white guy and assume that you belong in those meetings, that you deserve those meetings. So just call the assistant and say, I'd like to schedule a meeting. Like, you deserve it, because that's who gets the meetings, is people who assume they deserve it. And it's usually white guys.
Yeah. No, I think that analogy holds. And that's why it's so important. Just like healthcare providers should reflect the communities they serve, that needs to happen in philanthropy too. Our board has changed a lot over the last 10 years. My time at the foundation, it has become younger, more racially and ethnically diverse. It actually has some grantees on it. And it has people who truly believe, as part of their own personal values and in their professional work, in taking on the effects of structural racism. So that creates a totally different dynamic. And I'm maybe what would be a traditional or prototypical health philanthropy program officer in that I come from healthcare, but I'm one of, I think, only 3 physicians at the Robert Wood Johnson Foundation, and we have 250 staff. And over the past 5 to 10 years, our staff has become much more diverse too, in terms of where they come from in the country, what types of professional backgrounds they have, and who their networks are. Because like you described, it's our networks that determine who has access to us, who we think is worthy of attention and time. And I'll say, I have learned so much from my fellow program officers who come from community organizing, or who come from the nonprofit sector, or who come from even different parts of the healthcare system, like people who are midwives or doulas. So that richness makes a huge difference in what we fund and how we fund it.
Yeah, absolutely. That's really cool to hear. My colleague, Edgar Villanueva, is on the board now, and I was really excited when he got appointed to the board. And I think that was, I'm sure, a signal to many of us about the kind of people and thinking that was happening in terms of really addressing these historic and chronic issues, since Edgar has really focused on decolonizing philanthropy and using philanthropy to repair harm that's been done to Native American communities and other communities in this country for hundreds of years. So that's just the only one I know. But
yeah, he's a great example. I remember I was in a board meeting a couple years ago. It was soon after Edgar joined our board, and we were talking about tax policy and the ways that it affects kids and families, their economic security, their health and well-being. And he asked a question about, how does reparations fit into this work? And I'll say we didn't have a great answer at the time. Now I think we might have a much fuller, encouraging answer. And it actually connects to this work that I was describing around defending racial equity. One of our partners is a new organization that is organizing lawyers to help shape and defend reparations policies all across the country. Because just like a healthcare strategy that's race conscious, or just like affirmative action, reparations policies are fundamentally about repairing harms that were done based on race. And they have already started to be challenged in court, like the reparations policy in Evanston, Illinois. So that's an example of kind of our overall portfolio, which really is about defending these racial equity approaches that we know are essential to the health of our nation.
Yeah. So tell us more about the portfolio and this funding for policy and legal work defending health and racial equity.
So I think the story that's being told about racial equity work by opponents is that it's illegal, divisive, and un-American. And what we and our partners are saying is that the vast majority of racial equity efforts, even now in this environment, remain legal, that they hold the promise of benefit for everybody, like we were talking about, and that they are really fundamentally about our founding ideals as a nation. We have a 4-part strategy that we've been able to invest in over the past 3 years. The first is around legal advocacy. The second is communications and narrative work. And the third is supporting leaders both within sectors like healthcare, but also across sectors, who are trying to navigate this new world when it comes to racial equity efforts. We've put over $20 million into this effort over the past 3 years, and we've seen some incredible wins and shifts from it already.
Wow. You want to talk about any of the grantees or their efforts?
Yeah, so maybe I'll start with the legal work.
Mm-hmm.
So when I say legal advocacy, it's a couple things. The first is helping nonprofits in particular, but also higher education, health systems, navigate the current legal and political climate when it comes to their racial equity work. So part of it is legal advocates that can help those groups navigate the current terrain and to keep their work going as fully and as effectively as possible. So that's legal analysis, legal advice around the designing of programs so that they are as strong as possible and can stand up to any legal challenge that they may face. Mm-hmm. But the second part of it is about actually trying to shape the legal conditions so that the work can continue more fully into the future. And that, in many cases, looks like litigation. And a number of partners have been at the forefront of challenging anti-equity policies from the Trump administration.
Wow. Yeah. Incredible. And so, one of the things that we've talked about a lot on this show, and I'm sure you all talk about internally, is the challenges of mobilizing the philanthropic community last year and this year. It's going to be an ongoing thing when not only are the premises of things like diversity, equity, and inclusion being not just challenged, but censored, punished, whitewashed off the walls of museums and national historic sites. Not only that, but then nonprofits being targeted themselves for censorship, for defunding, for destabilization, for propaganda. And not only that, but foundations being targeted really for the first time and threatened, endowments threatened to being taxed in extreme ways or being investigated in political weaponized ways. So it's just been so hard for so many nonprofits to get that funding for advocacy, for legal work, for all these things, or just whatever they do, if it has any whiff of controversy or quote unquote advocacy that might then somehow come back to the funder as, well, this is part of as a funder, some percentage of your money going into advocacy and then that becoming a fear factor for the funders. It's just been such an unusual environment for philanthropic practice and fundraising. So I'm curious, what does that look like internally? Because it seems like a lot of foundations have taken a more, you could say, reasonable wait and see approach, or a head in the sand approach, or a let's really focus on any of our grantees. Did they get defunded? How can we help them? And that's going to be kind of our focus, not a more proactive, let's go advocate to protect our values or the progress that we've been supporting for years. So curious to hear your thoughts on how that has felt at RWJ and in other spaces of health grant makers and in philanthropy.
We have seen across the philanthropic sectors, as you alluded to, a huge retrenchment in investments in racial equity work and in public support for racial equity work. So we are not immune, just like you said. Whether it's law firms, universities, corporations, I'd put philanthropy in there. We have tried to take a different approach at the Robert Wood Johnson Foundation. We haven't gotten it perfect, but we do think that there are a series of things that we've done that some other funders can learn from, just as we have learned from some of our peer funders. I think it starts with our leadership, our board, which I already mentioned, which is chaired by Starsky Wilson from the Children's Defense Fund, our president and CEO, Dr. Rich Besser, my boss, Dr. Avenel Joseph, the vice president for the policy department. They have said that one option would be for us to become silent and pull back. But the other option, which is much more consistent with our mission and our values, is to redouble our commitment in a time of controversy and difficulty. That's what Dr. King said about commitment, right? You really understand people's commitment when they are put under pressure. And our leaders have really taken that on as a challenge. So we have redoubled our commitments. And for us, that means maintaining or increasing our investments in racial equity work and also being public and vocal about it. Because what we hear over and over again from our nonprofit partners in the field is that when you speak, it helps us speak too. It gives us some cover and it gives us some support. It gives us some wind at our back. And it also reminds other institutions, both within philanthropy and outside of it, that there are some organizations that are still willing to talk about this. So we have seen that as an essential role for us. And I think it gets at this idea of risk. Historically, philanthropy, when it is thought about risk assessment, has thought about risk to themselves, risk to philanthropy. But what we have really learned, and I think some other funders have learned, is that risk assessment should really center our grantees. It should focus on the people on the front lines who are doing the hardest, most essential, and most contested work. And that if we focus on the risk to our partners, then we realize how much risk there is in pulling back versus the risk in continuing. And I think like flipping the risk analysis has been really important for us. And it's one that philanthropy really needs to grapple with.
Yeah, that is a great reframe. Hadn't heard it put like that, but I think that's absolutely right. And I think it worked in the pandemic because nonprofits were under pressure, but the foundations weren't under this threat. I mean, they were under the threat of getting COVID, but they weren't trying to like still serve people in person in that environment. Now we have so many foundations feeling threatened, mostly indirectly, but the looming threat. And that has made a huge difference, I think, in a negative way.
Yeah. And it's real. I don't want to downplay the threats to foundations, but the thing we have to remind ourselves is that the risk we face is nowhere near the risk that our grantees face. Plus, we have so many more resources available to us, financial, reputational, than our grantees do. So if we can't navigate and stay committed through risk, then how can we expect our grantees to do that? So I think that's what we've tried to remind ourselves. But there's more. There's more we can do, and we can't get complacent. I think the biggest thing is getting more dollars out to the field.
How has RWJ handled that in terms of like the payout issues in this last year?
So in 2025, I believe we had our highest payout in our history, but it was below 7%. So above the required minimum 5%. But there are other foundations that have gone much higher, like the Freedom Together Foundation, the Marguerite Casey Foundation. So I think we look to them and say, we can do more. We did more than we ever did last year, but there's even more we can do. And that's a regular conversation that I'm not the one, for better or for worse, making the decisions at my foundation, but it's all of our responsibilities, every single staff person, to make the case for why more investment matters. Yeah.
I was curious to hear any thoughts you had on where things stand now after last year. I don't know if the dust has settled. I don't think it really has. But where do you think we stand in terms of race and DEI as a country and as a social sector right now?
Yeah, I guess I see both sides of it. One side is that we have lost so much over the past year plus in terms of real financial commitments, leadership, and actual programs related to health and racial equity that will take a long time to build back up. You can look at something like NIH research grants. They were one of the things that were targeted because of allegations of funding research that was about illegal DEI. Now, several of our partners actually brought lawsuits challenging the federal government's grant terminations, and they were able to get thousands of grants reinstituted. But NIH continues to find new ways to defund that work. So it will take time and energy to build back up to where we were before. On the other hand, I think a year in, there are a few important things that are happening. The first is that many times when the administration has been challenged in court or the court of public opinion about their anti-equity policies, they've lost. And that gives every nonprofit and other organization that might have pulled back and might have pulled back prematurely and unnecessarily to say, okay, we took maybe a drastic, unnecessary step. How might we thoughtfully ratchet back up some of our equity interventions in ways that are aligned with our mission and that are legally thoughtful. So I do think there's a little bit of a window now because that initial onslaught has passed. So that's one. Two, what we've heard from a lot of our partners is that many organizations have kept equity work going, but they've had to decide which of our equity efforts do we think are so effective and so aligned with our mission that we're going to continue it even though there may be pushback and scrutiny. So in some ways, you've gone from a big universe of equity strategies to a smaller set that are maybe the most important and impactful. And just like any field, not everything we're doing or will be doing is effective. So we want to have a little bit of a critical lens to the work that we're doing. Of course, we don't want it triggered by the sabotage that we've seen from the federal government, but there is an opportunity to say, okay, which of our strategies are actually working and which aren't? And how do we get more of our equity strategies to be effective? And then I think the last thing that we're seeing a lot of energy on is imagining what a future looks like, let's say within healthcare, that has been changed in a much more transformational way. And we're just seeing more and more energy around that, like reimagining what our healthcare system could look like, reimagining what our democracy should look like. So it's kind of the defense and the visioning at the same time. And I think especially with our 250th anniversary, many of our partners are looking at that as an opportunity to have conversations around the big changes that we need in our society for equity to actually be a reality.
Yeah, I sometimes try to think about, to keep myself buoyed, that we had Hoovervilles before we had the New Deal, that sometimes things have to get really bad in order to prompt a whole political populace to make change. It's hard to say that or to think of that as a good thing, though, because so many people get hurt in that process of the Hoovervilles, or in our case, all the things that are happening in the country now.
And you're right. The cause and the consequences of what's happening now are totally unnecessary and awful. Separate from that, the work that's happening to reimagine more just systems is totally necessary.
Yes.
And something that I'm reminded of is the thing that helped desegregate hospitals in our country was the passage of Medicare.
Wow.
Because that was a huge new revenue source for hospitals, including those nonprofit ones we talked about. And if they wanted access to it, they couldn't have segregated facilities. And that came out of the New Deal. So what's the next set of reforms or transformative actions that not only make sure everybody's in our health and healthcare system, but that everybody is treated respectfully and with high quality care? I think one of the things that we remind a lot of people in the health sector is that if you're pulling back from racial equity efforts, you might be saying that you're doing it because of risk or because you don't want other parts of what you do threatened, your funding. But ultimately, racial equity work is about the quality of care. And if you care about quality, you have to care about racial equity efforts. And for some people in the health space, that's actually a really helpful way to think about it. You wouldn't get rid of other quality efforts. And if there are people that you're serving that are getting lower quality care, and it's because of things that are actually remediable, then you have to remedy them. So that's one thing that we're reminding people. And it connects to this common thing, a common concern of wanting high quality, respectful, affordable care. Everybody needs it, but then groups that have been historically marginalized need it even more. So how do you create strategies that meet their needs and then thereby create a system that works better for everybody?
That's a beautiful note to wrap up on. And I think you've given folks a lot to think about for this year, ways to think about these issues and take action. If folks want to learn more about your funding, about the foundation, or connect with you, what's the best way for folks to find RWJ and your work and you?
So rwjf.org, that's our website. And if you search there for health equity or DEI, you'll pretty quickly find further information about some of the work that I'm describing. Listeners can be in touch with me. I'm on LinkedIn, easy to find. One of the few Giridhar Mallyas on LinkedIn, not the only one. but that's a good way to reach me.
Great. Well, this was educational. Thank you so much for making time to share your work, and thanks for what you're doing, Dr. Mallya.
Thank you, Rusty.
Thanks for listening to the Fund the People podcast. Visit fundthepeople.org and click on podcast to find the show notes and resources from this and other episodes. If you enjoyed today's episode, we'd really appreciate a 5-star rating and a quick review or comment in your podcast app of choice. It helps more people to find the show. To get the extended version of this interview, plus lots of bonus content, I invite you to join our Patreon community. Visit patreon.com/fundthepeople to subscribe today. Thank you for the work you do. Remember to keep your tank full, take care of yourself, and take care of one another.